Welcome to this class on neuroscience of human movement. In this class, we will discuss neuropsychiatric disorders arising out of basal ganglia dysfunction. So, slightly different from the regular classes that we see, in which we usually limit our discussion to movements and dysfunction of movements. In this case, we are going to discuss psychiatric disorders, right. We will take 3 examples of neuropsychiatric disorders: obsessive compulsive disorder, Tourette syndrome and depression, and discuss the possible role of basal ganglia in these disorders. So, essentially the question is, how does basal ganglia possibly cause, or dysfunction of basal ganglia possibly cause this, right. Let us remember that we discussed 4 independent loops of basal ganglia, right. So, these are essentially the skeletomotor loop, the oculomotor loop, the limbic loop and the executive or association loop. So, now if there is lesion in the executive or associative loop, or if there is a lesion in the limbic loop, right, and this leads to behavioral disorders, disorders of behavior, right. So, essentially these are caused due to lesions of non-motor basal ganglia thalamocortical circuits, right. So, it is because of lesions in the anywhere in this loop, right. So, it can be here or it can be in the thalamocortical loop, it can be in the striatum, or it can be the GPA, right. A lot of experimental evidence actually comes from the usage of the GABA receptor antagonist bicuculin, right, in basal ganglia circuits, and it has been shown that in animal models, injection of bicuculin in specific areas cause specific dysfunctions. So, if the injection is to the limbic part of the GP, there are stereotypical movements, whereas if it is to the associative part, there is hyperactivity. Abnormal movements are observed only when the injection is in motor areas. So, depending on which part is affected, then the response also varies. So, that means if that particular part is lesion for whatever reason, then the response is going to vary according to the region that is lesioned, okay, and the network, part of the network that it forms. So, if it forms part of the limbic circuitry, then that is going to result in a specific neurobehavioral disorder. If it forms part of the executive or associative network, then that is going to cause a specific behavioral disorder. So, and these two are not expected to be the same. If it of course forms part of the motor circuitry, then it is going to cause some motor disorder. So, one example of behavioral disorders is obsessive compulsive disorder. In this case, people keep on doing something because they never feel that they have done it enough number of times. Say for example, washing hands, a very common example. People keep on washing their hands, every few minutes once the person has to wash their hands. So, they have an obsession to keep on doing this, right. So, they are repeated actions. So, and this is something that they cannot change. You keep telling them, hey, this is not required. This is something that they can change so easily. It is not something that they can change so easily, right. And so, that means they have rigid behavioral patterns. You would observe this also among some of your classmates or co-workers, right. Some people do things only in a particular way, they cannot do it in different way. An extreme form of that is obsessive compulsive disorder, right. We all have habits, we all keep doing things in specific ways, right. So, that is habit, but if you cannot do it in any other way, right. So, if you do this at the exclusion of other things and in such a way that it affects your normal life, then that becomes obsessive compulsive disorder, and an extreme form of that becomes obsessive compulsive disorder, right. So, again what is basal ganglia's role in this, right? It is believed that this is caused due to compromised basal ganglia function in the sense that the important role of basal ganglia in procedural learning, right. Let us remember one thing, some time ago we discussed the role of basal ganglia in learning, right. So, we said that a specific part of basal ganglia plays a role in acquisition of tasks, whereas a different part of basal ganglia plays a role in doing well practiced or well learnt motor tasks. This is what we discussed some time ago. So, that means basal ganglia is a procedural learning engine. So, it is learning procedures, not just input output relationships, abstract representations. So, this is differentiated from factual learning, right. So, remembering some facts and figures and numbers, that is different from remembering a procedure. So, essentially even in the motor function, right, even in motor function basal ganglia is involved in procedural learning. If this procedural learning is compromised in the limbic or associative area or limbic or executive area, then what happens is you have a disorder such as OCD that develops, right. And imaging is very useful in understanding how this disease affects or which particular area of the basal ganglia is active or abnormal or showing abnormal activation during specific activity. It turns out that ventral striatum has been implicated, specifically nuclear accumbens, and ventromedial caudate nucleus have been implicated. In other words, these two regions show abnormal activation when compared with age matched controls, for example, right. And it turns out what is more interesting is that surgical removal or stimulation of specific regions, right, anterior limb of the internal capsule and ventral striatum seem to help these patients to overcome these symptoms. That means that these particular regions, right, these particular regions are the ones that are malfunctioning or are at least forming an important part of the network that is responsible for this particular function, right. So, this is obsessive compulsive disorder. Then there is Tourette syndrome. Of course, you might have seen this movie Hitchki, right. The recent Hindi movie on this particular syndrome, where this lady Rani Mukherjee, she performs this like that frequently, which makes it socially awkward, and also she wants to be a teacher. So, it is a very difficult situation. You have some sort of expression disability. This is causing vocal tics, right. So, motor or vocal tics that are similar to OCD. So, there is obsessive compulsive necessity for these people to do this tics. She also does something like cha 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 cha, like. In the case of OCD, the person has to wash the hands or do something else. In this case, the person has to keep on doing this vocal tics, right. So, and of course, the story is something I actually have not seen the movie. You should see it if you are interested, but you should also read about it if you are interested. So, these vocal tics are probably due to dysfunction of basal ganglia. How do you know that this is due to basal ganglia dysfunction? Well, it turns out that using dopamine receptor blockers reduces tics in many cases, specific regions of basal ganglia that are not functioning well, that cause this kind of vocal tics, typical of Tourette syndrome, right. And some treatments have been attempted. Chronic stimulation of limbic and motor circuits and at the thalamus and the pallidal levels seem to help these patients. How do you stimulate chronically? Well, of course, this is a surgical procedure. So, this involves implanting electrodes in particular regions of the basal ganglia and using a pacemaker kind of device, right. So, this is a pacemaker kind of device that continuously stimulates the specific regions and ensures that the person does not produce this unwanted, undesirable, socially awkward tics, right. So, Again this is just therapy, this is just a therapeutic approach that is coming up. We will have to wait and see how effective or this is, or if there, what are the other effects that this brings in, right. Another disorder is depression. In this case, what the person has is low mood, low self esteem. What's normally supposed to help a person enjoy, right, this is not interesting for these people. So, activities that are enjoyable are not of interest to people with depression. In general, low energy, and they have pain for no particular reason. So, pain without a clear cause. Actually, this also causes other physical disorders from time to time. What causes depression? Actually, that is the $1 billion if not a $1 zillion question, because we do not understand the pathophysiology of depression. So, treatment methods are limited, and the available treatment methods come with baggages, come with side effects. So, it is not clear what this disorder is, and the exact role of basal ganglia in this is also not completely understood. However, it is believed that basal ganglia must form an important part, or at least some role in disorders such as depression, right. So, this is something that is an open question for the future. So, we need to continue our research and understand why depression is caused and what is the approach towards treatment of depression. So, in summary, what we have seen is that neuropsychiatric disorders of basal ganglia are due to dysfunction of specific circuitry in the non-motor regions, right. So, are lesions of the non-motor regions of the basal ganglia, thalamocortical circuits, right. We saw some examples. We saw obsessive compulsive disorder, which make people to engage in rigid behavior and keep repeating specific tasks for no particular reason. Tourette syndrome, where the person produces vocal tics such as due to reason similar to obsessive compulsive disorder, right. And depression, it is believed that basal ganglia must play some role in depression, although it is not clear what exactly that role is. So, with this we come to the end of this lecture. Thank you very much for your attention.